Hey everybody, it's your favorite doctor here, Dr. Tiffany Butler. And in this video, I will be talking about children. I'm talking children, adolescents, but we're going to start off with the baby, all right, and how chiropractic care can help your child, all right? So when we're thinking about the spine, all right, we're not just thinking about the lower back. We have different regions of the spine, and I'm going to bring my handy spine out so we can go over anatomy a little bit. So we have the cervical spine, all right? We have the thoracic spine on the mid back, and this is where your ribs connect to your spine. We have the lumbar spine. This is the lower back. We also have the sacrum. This here is like a blade. I'm going to show you on this one here. It's a little bit better. Okay, we have the sacrum, and we also have the coccyx. All right, now, children, babies. We're going to talk about babies first, all right, and chiropractic care. So we know that when a baby is born, right, super flexible, right? You can literally, right, with your baby, can you do this? The baby super flexible, mostly cartilage, right, within the joints, because they're growing, right? So super flexible, all right? Baby should be able to move their heads at a certain age, right? Okay, baby should be able to move the arms and the legs and things like that. So when you're taking your child to the pediatrician for their monthly checkups, they're looking for certain things to make sure, one, that the child is growing and developing. So because the baby can't communicate in terms of words, you know, they'll cry from discomfort. And sometimes you may not know what's going on with the baby. So one of the things when I have a baby, like a little baby, we do an exam. So in chiropractic school, we're taught this, right? How to evaluate and to assess children. And what we're looking for is any type of muscle or joint type of dysfunction. And what I mean by dysfunction, not that there's damage in a sense, but we're looking how well does the baby move? Is the baby's muscles relaxed when they're laying down, on their arms? You know, do they have mobility and function? You know, flexibility. We're looking at different things. So our exam of a baby will be very different from the pediatrician or MD, okay? So we're looking at the musculoskeletal system, all right? And we always look at the relationship that the nervous system has, because the brain, the nervous system, spinal cord, spinal nerves, they control everything. So this is sort of like a window evaluation into how well the baby's brain is functioning as well as the nervous system. So we do an exam. And depending on what's going on with the baby and what areas, again, just like how we do an adult or adolescent or young child, will adjust. Now with children, small children, we'll use maybe the thumb, right? Or we'll maybe use a constant contact. We may even use instrumentation, something called an activator. And I'll show you a picture somewhere up here. So these instruments, whether it's our hands, use it as an instrument, or that, the whole point is to help to mobilize the joints, right? To help the baby to get more mobility and flexibility, right? Because it's a child. So we may take the head, we may do an exam, have the baby move in any area they feel restricted. Very light, gentle adjustment applied to the baby. We do not do whatever you've seen done before. We don't do that to the baby, all right? You got to be careful with the baby. And like I said, if you have any questions, you can always send me an email at info@drtiffanybutler.com. All right, thank you for watching the video. Continue to create a great day. And as I always say, that a healthy mind and healthy body creates a healthy life. Till next time, stay healthy.